How many of you right now watching this video have an issue with your back? Maybe you have to shift in your chair and try to find a comfortable position, or you woke up this morning and felt that familiar ache that's been your unwelcome companion for 5 years, 10 years, maybe longer. I'm here to let you know that it doesn't have to be that way, and I want to help you. Because when people come to me and say, oh, I just have a bad back, like it's a character flaw they were born with. But here's the thing, this might blow your mind. That pain you've been carrying around for years, that one that flares up when it rains or when you sit too long or when you try to pick up your grandkid, it's probably not what you think it is. And more importantly, it doesn't have to be permanent. I'm Angelo. I've been practicing orthopedic massage for nearly 30 years in Los Altos. And today I'm going to tell you why orthopedic massage might be the missing piece you've been looking for. But let me tell you a story that I have of a client that came in. She was about to get surgery on her low back the next day, and she heard from a friend that she had to come in and try this therapy out because it helped him and helped him do wonders for his body. So she made the jump. She came in and she was very skeptical. I did my assessment. I didn't see any glaring issues that required her to see the doctor immediately. So I told her, let's give this a shot. I don't know how much I can help you, but we'll do our thing. The next week she came in and she had this glaring look, and she walked up to me quickly and said to me, I don't know what voodoo you did, but my back pain is about 90% better. And the real kicker is that this is not an uncommon thing that a lot of my clients say to me. It's not that I work miracles, it's just that I've learned to work with these soft tissues in ways that most conventional therapies don't. So let me show you something. This towel, you see this? Now when I twist it and leave it twisted for a while, it will tend to stay that way. And that's very similar to our connective tissues. When we sit for long periods of time or have an injury, these connective tissues get stuck in that position and the fibers start to bind together. Well, that's exactly what happens in your body, except instead of happening in a few seconds twisting, it happens over years. Think about your daily life. You sit at a computer, your hips flexors get tight, your shoulders round forward, you sleep on your side in the same way every night, and certain muscles never fully lengthen. Maybe you had a car accident in 2015, or you threw your back out moving furniture, and your body compensated by changing how you move. Your nervous system is incredibly smart, but sometimes it's too protective. When you get injured, your brain says, okay, we need to guard this area. So muscles that should be relaxed stay tense, and muscles that should be strong become weak. And over time, this creates what I call a compensation pattern. The problem is your brain never got the memo that the original injury healed. So you're walking around with a internal security system that's still on high alert years later. I see this every single day. People come in and tell me, my left side is always tight, I can't turn my head to the right without pain, or every morning I wake up stiff. These aren't separate problems, they're all connected to these old patterns your body is holding onto. And here's the thing that most treatments miss completely. I'm not here to bash other healthcare providers. Physical therapists, chiropractors, doctors, they're all doing important work. But here's what I've noticed over nearly the 30 years doing this work. Most treatments focus on the spot that hurts, not the reason why it's hurting. You go back to the doctor with back pain. They might give you an MRI. The MRI shows some disc degeneration, which, by the way, is totally normal as we age. It's like finding wrinkles on your face and calling them a disease, but suddenly that's the cause of your pain. So they treat the disc, maybe injections, maybe they talk about surgery, but nobody's asking why that disc got stressed in the first place. Another client, let's call him Dave, who had 3 back surgeries, 3 of them. Each time the surgeon said the operation was successful, but Dave kept having pain. Different spots, same problem. When Dave came to see me, I found that his real issue wasn't his spine at all. It was his left ankle. He'd sprained it playing basketball in college 20 years earlier, never fully healed properly, so his body had been compensating ever since. His left leg wasn't absorbing impact correctly, which put extra stress on his hip, which changed how his pelvis moved, which eventually overloaded his back. We spent most of our time working on his ankle, his calf muscles, his hip flexors. His back? We did some work, but most of our time was addressing a lot of these compensation patterns. And what happened to his back pain? It disappeared. Not managed, not better, just gone. And that's the difference between treating symptoms and treating causes. And that's why pills and injections and even surgery sometimes fail. They're not addressing the real problem. So if you can imagine for a second, what if the body you're living in, the one that's been hurting for years, could remember how to move like it did before the pain started? What if those muscles could relax, those joints could move freely, and that constant background tension could just be gone? Because here's what I've learned. Your body wants to heal. It's just been stuck in old patterns. And by using orthopedic massage, we know how to unstick them. So what exactly are we doing here? And how is it different from that relaxing massage you get at the spa? First off, I'm not just rubbing muscles randomly hoping something good happens. Every technique I use has a specific purpose based on what your body is showing me. When I work with someone, I'm feeling for areas where the tissues feel different. Maybe it's ropey or sticky, or it doesn't glide the way it should. These are adhesions. They're places where your fascia, that connective tissue that wraps around every cell of your body, has gotten bound up. Think of fascia like a white part around an orange segment. When it's healthy, it's smooth and slippery, but when it gets irritated or injured, it can become thick and sticky, like when you leave honey out and it crystallizes. So I use specific techniques to restore that glide. Sometimes it's deep pressure, sometimes it's gentle stretching, sometimes it's what we call neuromuscular therapy, basically convincing your nervous system that it's safe to let go of old protective patterns. But here's the part that most people don't understand. I'm not just working on the spot that hurts. I'm looking to address your whole body as a connected system. If your right shoulder is tight, I might need to work on your left hip. If your neck hurts, the problem might be in your rib cage. Everything is connected through these fascial lines that run throughout your body. And here's the really cool part. Your body has an incredible ability to reorganize itself once these restrictions are released. I've seen people's posture change in real time during a session. I've watched chronic pain patterns that have been there for years dissolve in a matter of days or weeks. The other thing that makes orthopedic massage different is that I'm also working with your nervous system. You see, chronic pain isn't just about tight muscles, it's about a nervous system that's stuck in protection mode. Through specific touch and pressure, I can actually help reset your nervous system's response. It's like updating the software in your body's security system so it stops sending false alarms. I had another client, her name is Jennifer. She was a teacher here in Los Altos and had been dealing with what she called morning back pain for about 8 years. Every single morning, she'd wake up stiff as a board. It took her about an hour of moving around before she felt human again, as she said. She said she tried everything from new mattresses, different pillows, stretching routines, and nothing seemed to give her long-lasting relief. When I evaluated her, I found something interesting. Her pain wasn't actually about her back muscles being tight. It was about her breathing. Years of stress, and I'm sure many of you know how this is, had changed how she breathed. Instead of breathing deep into her belly, she was breathing shallow into her chest. This kept her diaphragm tight, which affected her rib cage, which changed how her spine moved. So instead of focusing on her back as much, we worked on releasing her diaphragm, opening up her rib cage, and teaching her body how to breathe properly again. 3 weeks later, she texted me a photo of herself doing yoga first thing in the morning. No stiffness, no pain, just normal, comfortable movement. That's what happens when you address the real cause instead of just treating the symptoms. The change isn't just about pain relief, it's about getting your life back. If you've been told that you just have to live with your pain, or that it's just part of getting older, I want you to know that's not true. Your body is designed to move without pain, no matter how old you are or how long you've been hurting. And here's what you got to know about chronic pain patterns. They're like that friend who overstays their welcome. The longer they stick around, the more comfortable they get and the harder they are to get rid of. But here's what I've learned. Change can happen faster than you think. Your body wants to heal. It wants to move freely. It's just been waiting for someone who knows how to help it remember. I've worked with people in their 70s who thought their active days were over and watched them get back to gardening, traveling, playing with their grandkids. I've worked with young professionals who thought chronic pain was just the price of their career success. The common thread? They all decided to stop accepting pain as normal and started looking for real solutions. Every day you wait is another day your body reinforces these old patterns. But every day is also another opportunity to start the healing process. I'm Angelo, and I've been specializing in this type of advanced therapeutic bodywork for nearly 30 years, right here in Los Altos. My approach isn't about quick fixes. Or temporary relief. It's about helping you understand your body better and giving you the tools to live without pain. If what I've shared today resonates with you, if you're tired of managing your pain instead of resolving it, I'd love to help you figure out what's really going on in your body. Click below to schedule a consultation where we'll spend some time talking about your specific situation, and I'll help you understand what's really causing your pain and how we can address it effectively. You don't have to live with this back pain. You don't have to accept limitation. Your best, most comfortable years can still be ahead of you. Thanks for watching, and I'll see you soon.